Welcome to the Deep Dive. Today in What's New in 22Q, we're peeling back the layers on a topic that brings significant concern and, well, many questions for families. Epilepsy in individuals living with 22q11.2 deletion syndrome.
Hmm.
This syndrome is, as you know, incredibly complex, touching many different systems, and understanding its neurological side, things like epilepsy, is truly vital.
Yeah.
Our mission today is really to simplify some important new research, turning, complex findings into practical insights you can genuinely use
Yeah.
in your daily lives and in conversations with medical teams.
Absolutely. And we're going to navigate some fascinating recent studies that truly shed new light on how epilepsy presents in 22q11.2 deletion syndrome. We'll look at what influences it and maybe most importantly, what this means for you and your family.
Okay.
We'll be putting a strong emphasis on one particularly significant and very new study that offers, I think, some clearer answers than we've had before.
Okay, let's dive right into that central study then. You
Mhm.
said it gives us a much clearer picture of generalized epilepsy in 22q11.2 deletion syndrome.
Hmm.
So, uh, what is this research exactly?
Right. So this comes from a big multicenter study. The lead author is Emmanuel Cerulli-Irelli, and the title is Phenotypic Traits in Family History in Patients with 22q11.2 Deletion Syndrome and Generalized Epilepsy, a multicenter case control study.
Okay.
It was just published in the journal Epilepsia in 2025. So it's essentially hot off the scientific presses.
Wow. Okay. So 2025, and what was the big question they were trying to sort of unravel with this research? What do they want to understand?
Well, essentially, they set out to understand the differences, the distinctions between individuals with 22q who do experience generalized epilepsy
Right.
versus those who don't. They looked at, everything from the specific types of seizures and brain activity patterns to other health conditions that might occur alongside it, and even the role of family history.
Mm.
It was, a really comprehensive look.
That sounds like a massive undertaking.
Oh.
So let's get right to it. What were the most important things they uncovered, especially about how this type of epilepsy often, presents itself?
Yeah, so what's really striking here is that many individuals in the study had their first generalized seizure around adolescence. The median age was about 15 years.
Okay, adolescence.
Yeah. And the most common types they saw were generalized tonic-clonic seizures. You might know them as full-body seizures.
Hmm?
And also myoclonic seizures, which are those brief, sort of shock-like jerks. Often these happen together.
In combination.
In combination, yeah. Some also had absences, those
Ah.
brief staring spells. And a really notable kind of practical finding was that many seizures specifically happened in the morning, like shortly after waking up.
That's a very specific pattern. Does that give researchers any clues? Or maybe it suggests a particular monitoring strategy for families if they notice things happening early in the morning.
That's a great question. It certainly highlights a pattern that clinicians can watch for, and families too. And when they did the brainwave tests, the EEGs, they typically showed these patterns of generalized spike wave discharges,
Oh.
which is a very specific electrical signature that helps doctors, accurately diagnose this type of epilepsy. But what's important for you to know is that unlike some other forms of generalized epilepsy, these patients didn't typically have photosensitivity.
Ah, so flashing lights weren't usually a trigger.
Exactly, or other specific environmental triggers. So that helps clarify what might not be a common thing to worry about as a trigger.
Now, the crucial question for anyone managing epilepsy,
Hmm.
how effective are the treatments? What did the study find about how these seizures respond to medication?
Right, and this is where it gets incredibly encouraging, actually.
Good.
The really good news is that most patients, a remarkable 96% in this study, responded very well to anti-seizure medications, ASMs.
96%. That's high.
It's very high. It means their seizures were effectively controlled. Only a very small percentage, just 4%, had what's called drug resistance, where the meds don't work so well. So this really suggests a generally favorable course for epilepsy in 22q. It offers real hope for good seizure control.
That's a powerful message for families, definitely, knowing that effective treatment is so often possible. But does this mean the epilepsy eventually goes away? Can medications be stopped later on?
Yeah, that's an important nuance, isn't it? And the study does shed light on that. They found that when medications were stopped, a significant majority of patients, 75%, actually had their seizures come back.
Oh, okay. So 3/4 of them.
Right. So it indicates that while the seizures respond well to treatment, there's often this persistent underlying susceptibility. It suggests that long-term or maybe even lifelong treatment might be necessary for many people to stay seizure-free. The researchers actually called this pattern pattern oligoepilepsy, which basically means, good response to meds, but a continued predisposition to seizures.
Oligoepilepsy. Okay, so understanding that underlying susceptibility is key. Now, what about other health aspects? Things often seen with 22q. Did the study look at how epilepsy might connect to those?
They certainly did, and this is another really significant finding. They discovered that individuals with generalized epilepsy in the study had a significantly higher prevalence of intellectual disability compared to those without epilepsy.
Okay.
And their IQ scores were, on average, lower, too. And psychosis, which involves experiences like hallucinations or delusions, that was also more common in the epilepsy group.
Right.
So it suggests potential shared biological pathways in the brain, things that might influence both epilepsy and these other neurodevelopmental and psychiatric features. It's a reminder that brain health in 22q is, well, deeply interconnected.
That's a really important connection for thinking about holistic care, isn't it? Were there any other conditions that stood out as not being more common in the epilepsy group?
Yeah, interestingly, there were no significant differences in a history of febrile seizures, those seizures linked to fever in childhood. Or hypocalcemic seizures, the ones caused by low calcium. So it suggests that those earlier, often provoked seizures might not directly lead to the later development of this generalized epilepsy. What was intriguing, though, was a lower prevalence of skeletal abnormalities in the epilepsy group.
Lower. That is unexpected.
It is, and it certainly warrants some future research to understand why that might be.
This brings up a really interesting point about what does influence epilepsy risk then. Did the study look at the deletion itself, like the size or location of the 22q11.2 deletion? Was that different in people with epilepsy?
Great question. They looked closely at that, and they found no significant differences in the size or the precise location of the deletion between individuals with and without generalized epilepsy.
Okay.
So that tells us that the deletion itself, while obviously a fundamental factor, isn't the only thing determining if someone develops this type of epilepsy.
So what else is at play?
Well, what was highly significant was the family history finding. Individuals with 22q and generalized epilepsy were much more likely to have a family history of epilepsy, something like 30.8% compared to only about 8.9% in the control group without epilepsy.
Wow, that's a big difference.
It is. And this was true even in cases where the 22q deletion was de novo.
Meaning it happened new in the individual, wasn't inherited.
Exactly. It wasn't inherited from a parent with the deletion.
So that's profound. Even if the deletion wasn't passed down, other genetic factors from the family seem to play a role. How do scientists describe that?
Yeah, it strongly suggests that other genetic factors inherited from the family likely interact with the 22q deletion. They contribute together to the risk of developing epilepsy. It's what scientists call a polygenic mechanism.
Polygenic?
Yeah.
Meaning multiple genes.
Exactly. Multiple genes involved. Think of it like maybe like a recipe. The 22q deletion is a core ingredient, but other flavorings, these additional genes inherited from the family, can influence the final outcome. In this case, the likelihood of developing epilepsy. It's a combination of influences.
That makes sense. A combination.
So for families, this Cerulli-Urelli research offers several really key practical insights, things that can genuinely empower your conversations with doctors.
Okay, let's break those down. What's the first big takeaway?
Well, first, as we said, that powerful message of hope. Epilepsy in 22q generally responds remarkably well to anti-seizure medications.
Right, that 96% figure.
Exactly.
Yeah.
So there's a strong likelihood of achieving good seizure control. And that's incredibly important for quality of life, right? It's a huge step toward managing the condition effectively.
Definitely. But you also mentioned the persistence.
Right. And that's the second key point. It's equally important to be aware that even with good control, that underlying tendency, that susceptibility for seizures might remain. So while it's tempting, when seizures are controlled, to think about stopping medication, any decisions about changing or stopping treatment should always be a very careful, informed discussion with the medical team. Don't just stop on your own. Their expertise is really invaluable there.
Absolutely critical advice. Okay, what's next?
The third point is about that strong link they found between epilepsy and cognitive or psychiatric changes, like intellectual disability and psychosis.
Yeah.
For families, this means that any subtle shifts you notice in behavior or learning or thinking these should immediately trigger a holistic conversation with the medical team.
So don't view things in isolation.
Precisely. It's a reminder that brain health in 22q is deeply interconnected. Adjusting one aspect can often shed light on others. A comprehensive approach is best.
Makes sense. And the final practical takeaway.
And finally, that family history aspect is quite profound, I think. If there's a history of epilepsy in your broader family, aunts, uncles, grandparents, cousins, even if your child's 22q deletion is de novo,
Hmm.
it's another crucial piece of the puzzle to share with your healthcare provider.
Even if the parents don't have epilepsy themselves.
Yes, the broader family history. This helps the doctors consider the full picture of genetic influences. It can guide ongoing monitoring and care decisions.
That's really useful information to share. Okay, so the Cerulli-Arelli study painted a really clear picture of generalized epilepsy, but sometimes diagnosis itself isn't straightforward, right? Especially as people get older.
That's very true.
What happens when 22q is maybe only diagnosed much later in life, perhaps because of new neurological symptoms appearing? I think there's another study that touches on this.
Exactly. There's a short report that highlights this challenge. It's from Mike W. Zhang and colleagues, titled Short Report, Clinical Features in Epilepsy Monitoring in an Adult with 22q 11.2 Deletion Syndrome.
Okay.
This was published in the Neurohospitalist in 2024, and it describes the case of a 21-year-old adult who was only diagnosed with 22q after developing new-onset seizures, along with cognitive decline and some psychotic symptoms.
Wow, 21. So the diagnosis came much later.
Much later. And brain imaging in this individual revealed structural changes, things like periventricular nodular heterotopia, which are basically areas of misplaced brain cells,
Hmm.
and also Dandy-Walker syndrome, which is a type of brain malformation.
So this case really underscores how symptoms can change or emerge with age, doesn't it? And how important awareness is, especially if maybe those classic infant features weren't obvious.
Absolutely. It highlights that if an adult presents with unexplained epilepsy, especially if it's alongside developmental delays or psychiatric symptoms like psychosis,
Yeah.
and maybe they have other subtle physical features or organ issues, well, then comprehensive genetic testing should really be considered. Something like a CGH array, which looks for those tiny missing or extra pieces of DNA, like the 22q deletion.
Because getting that diagnosis even later can still make a difference.
Definitely. A timely diagnosis, even in adulthood, can truly impact care, management, and even family planning discussions.
Right. Okay, so these individual studies give us powerful new insights. But what does the broader scientific view tell us about epilepsy and 22q? You mentioned a review article.
Yes, to round out our understanding, it's helpful to look at a broader review. This one pulls together a lot of what we know and reinforces some key points, especially around prevention. This is a review article by Michael Bayat and Alan Bayat. It's titled Neurological Manifestation of 22q 11.2 Deletion Syndrome, and it was published in Neurological Sciences back in 2022.
Okay, Bayat and Bayat, 2022. What does it confirm for us?
Well, it reinforces the basics that 22q is the most common microdeletion, about 1 in 4,000 live births, and confirms that, yes, individuals with the syndrome have an increased likelihood of seizures. It specifically talks about provoked seizures, seizures caused by an identifiable trigger.
Like the low calcium you mentioned earlier.
Exactly. That's the most common cause, especially in younger individuals, hypocalcemia, low calcium, and often those seizures resolve once calcium levels are corrected.
Important to monitor calcium then.
Very important. The review also mentions that in adults, certain medications can be triggers too, particularly some antipsychotic medications like clozapine. That's something to be aware of.
So it's not just the underlying condition, but specific identifiable triggers that can bring on seizures. That offers clear targets for prevention, right?
Precisely. And beyond those provoked seizures, the review confirms that unprovoked, generalized epilepsy itself occurs more frequently in people with 22q than in the general population. It also notes, like the Zhang case study suggested, that brain imaging can often reveal structural changes, those neuroradiological findings, like polymicrogyria or heterotopia, which can be linked to seizures. And again, it reinforces that significant link between epilepsy and other challenges like developmental delay and psychiatric conditions, including psychosis. It pulls that thread through as well.
So this broader review really strengthens the picture and points towards specific preventative actions.
Yes, it does offer clear guidance on some specific preventative measures we can think about.
Okay, so first, maintaining normal calcium levels. That seems like a really practical and important step, as low calcium is a common and potentially preventable trigger.
Absolutely. Regular monitoring and appropriate supplementation, always as advised by the doctor, are key.
And the second point, about medications.
Yes, if antipsychotic medications are being considered, particularly for an adult with 22q, it's absolutely vital to have a detailed discussion with the prescribing doctor about the potential seizure risk.
Especially if there's a history of seizures already.
Especially then. Starting with low doses and increasing gradually can be important. And sometimes they might even consider using an anti-seizure medication alongside the antipsychotic as a precaution.
Right. So careful management there. Ultimately, what all these different sources, the big Cerulli-Arelli study, the Zhang case, the Bayat review, what do they really drive home for us?
I think the big message is the importance of comprehensive and ongoing dialogue with the medical team.
Yeah.
Because 22q affects so many systems, managing one aspect, like epilepsy, often connects to others in ways we're only just beginning to fully understand. Everything is connected.
That holistic view seems crucial.
It really is. And if we connect all this back to the bigger picture, the research tells us that epilepsy in 22q is often manageable with medication. That's the good news. But that lifelong susceptibility is common. It's not usually a cure in the traditional sense, but it does mean individuals can often live full, rich lives with the right support and careful management.
That's an important distinction.
Mm-hmm.
Manageable, but often needing ongoing attention. This really raises a question for you, the listener.
Yeah.
As parents, siblings, relatives, or individuals living with 22q, how does understanding these specific patterns, the types of seizures, the timing, the treatment response, and especially the role of broader family history, how does that change the conversations you have with your doctors? How does it shape your approach to care? Because this knowledge truly empowers you, doesn't it? It helps you be the best possible advocate, something to think about. This deep dive today is brought to you by 22q11 Europe, the European Association supporting families living with 22q11 deletion syndrome. Thank you for listening to What's New in 22q. Take care, and we'll talk to you soon.